Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. Later, we'll get an update on what's going on and around out there, how to protect yourself during a statewide flu outbreak, and clusters of whooping cough in Lexington. Also, some recent attention-getting reports about restaurant inspections. Fayette County Health Commissioner Dr. Kraig Humbaugh will be with us shortly. But first, an attention-getting report this week from State Auditor Mike Harmon. After extensively looking into Kentucky's public debt, Auditor Harmon came away with some eye-opening numbers. One of those is that about 80% of Kentucky's public debt is because of unfunded pension liabilities in the tens of billions of dollars. It's an issue that's proving elusive to deal with in Frankfort. Auditor Harmon is joining us this morning to talk about it. Thank you very much for coming. We appreciate it.
Glad to be here.
Thank you. So this is attention-getting.
Very much so.
Why did you decide to issue this bulletin? I mean, the timing was just as lawmakers were arriving and to start the session.
Well, what we have decided to do in the auditor's office, in addition to doing audits, we've also done what we call our data bulletins, and this is the second in our series of data bulletins. And one of the reasons we're doing is there's so much information out there that's wonderful for people to know, but a lot of times it's difficult for people to distill it down. So what we did is we took it, we distilled it down, put it in this particular case, 11-page report, so people can see. And as you indicated, one of the stunning things that we looked at for debts, whether you call it debts or obligations or liabilities, you know, we've got about $54.6 billion, and that's with a B, in debt if you include those pension liabilities. Unfortunately, about 80% of that is in fact the pension liabilities, about $43.3 billion. Now these are not numbers that we ourselves have audited. These are numbers that are on each of the sites, information that we have compiled to put into this report.
And then you did some other numbers. You looked into how much that amounts to in terms of really an obligation for every Kentuckian.
Yes, if you just do the simple math of taking how much is owed and you divide it by the number of individuals throughout the state, it equates to about $12,200, $12,300 for every man, woman, and child in Kentucky. So it's not, no one's going to be receiving a direct bill for each of that and for their households, but we like to put numbers in a situation so people can easily see the concern of an issue that does in fact need to be addressed.
Well, that's how heavy the burden is.
It is,
and
very heavy
facing
burden.
all Kentuckians. How much are we spending for interest on debt?
Well, from a standpoint of course, we looked at the total debt of $54.6 billion. Of that, about 11.3 billion is actually either appropriated or non-appropriated debt. Of that, we make about a 1.2 billion with a B payment on the 11.2. Now, obviously, that doesn't include the payments that we're making on the unfunded pension liability, because typically there's multiple costs involved with that. You've got the simple cost, and then you've also got what they call the ARC cost, where they mess up and they don't end up, hitting the right figures, and so they got to try to work to catch that up.
Obviously, dealing with the pensions has proven to be elusive and very difficult. You said it's 80% of the issue that Kentucky faces as far as debt. But you know the pressures from all sides going on, the stakeholders, the threat of legal action, which was taken and was successful last year. The pension bill that was passed was overturned by the state Supreme Court. How do lawmakers go forward in this situation?
It's a tough, difficult situation. I actually served 13 years in the Kentucky General Assembly, so we faced, very similar. I mean, personally, if I was still in there, I would probably recommend looking at at least three different bills. I know they had looked at moving everybody into what's the revised cash hybrid, which is what they're calling the Tier 4. I would recommend, if you're going to do that, do one bill to move every new person into that effective July 1st of 2019. I would probably recommend a second bill, because part of the process of the one bill, they were going to move the Tier 3 people into the Tier 4, which was the original cash hybrid that we had looked at while I was actually in there back in 2013. And I would do one bill to roll that. And then anything else, your level dollar funding or anything along that lines, you can address in a third bill. That way, if the third one gets struck down, it would be highly unlikely that 1 and 2 would get struck down.
So is Kentucky basically in a position of this could be dealt with going forward, but the obligations that are already there are there. Right?
The obligations are there, and one of the things they were wanting to do with the cash hybrid is right now the entire risk, other than the initial contribution from both the state and the individual employee, both of any additional risk, whether the assumptions are wrong or whether the payroll growth is wrong, that rests with the state, and by the state I mean the taxpayers. So with the cash hybrid, what it was going to do is kind of have a blended risk in that regards. Some of it would be on the employee, some of it would still be on the employer, because there's certain guarantees within that cash hybrid.
We hear that Kentucky has, one of, if not the worst funded pension system in the country.
Yes.
What are your findings on that?
Well, in our report, we looked at both, from the standpoint of total debt, as well as we looked at the bond ratings. Now, if you look specifically at the bond ratings, if you look at our 7 surrounding states, we are actually next to last when it comes to our bond ratings, with Illinois being last. So we said, thank goodness for Illinois. So.
Do you think we can get a handle on this? I mean, you watch the legislature, and as you said, a former member yourself. I mean, do you think this can get handled in this session, or is it going to take some time?
I would hope that it would be handled in the session, because the further we push it off, the more, if you're talking about if someone's bleeding or whatever, you've got to stop the bleeding, and then you can address it from a standpoint. But I think it can be. It's just the biggest problem right now. We are such a divided, whether it's this issue or other issues, we're such divided both in the state and the country. But we've got to find areas of commonality, and we've got to be able to come together, because it needs to be addressed. And the first step of addressing it is admitting that we do in fact have a problem.
All right, we'll see what happens. You are busy in your office in many other ways.
Very busy.
You have identified an area that you believe needs more legislative oversight, and that is, it has to do with economic development.
Yeah, economic development. If you look at our data bulletin, there are several what we call appropriated debt. Most of those individuals and most of those agencies have certain caps on the amount that they can appropriate. KEDFA, the Kentucky Economic Development and Finance Authority, does not have any cap, and we saw a situation with Kentucky Wired where basically the General Assembly appropriated initial $30 million, and then with one signature they flipped the script, and they put basically a $1.5 billion with a B obligation on the state, and by the state I mean taxpayers again, that with just one signature. So we need a situation where there needs to be proper oversight. Obviously on some of these items they will come before legislative committees, but their decisions can actually be overwritten.
Let's talk a little bit on economic development, what the state tries to do. Taxpayers apparently hold a $15 million stake in a promised company in northeastern Kentucky, Brady Industries. Right. We had the Interblue economic announcement over in Pike County, eastern Kentucky. That's now on hold. How careful does the state need to be with the promises it makes, or in fact, in some cases, obligations with money it makes, in trying to lure companies?
Well, in the past, generally what I have said, especially when I was in the General Assembly, I like economic development packages that are paid as an incentive when they're actually produced. For instance, you have some companies that, if they generate sales tax, they can get a portion of that sales tax back. But if they never generate a sales tax, then they don't get anything because they haven't generated it. So, I mean, I'm more in favor of things along that lines. I know you have to be creative. I know it's a competitive market. I think the current administration has done a good job in trying to get businesses in. There's been more commitments, billions of dollars of commitments, and unfortunately some of those, as you indicated, have fallen through. But it is an important thing for the state.
You looked into the Kentucky Information Technology Office, and some concerns were raised about how some very sensitive information is handled.
Right. Well, we just released our SWAC, the statewide single audit of Kentucky, and there were 2 findings. I think it was 10 and 11 that talked about COT, and some of those. Some of them had to do with not knowing exactly where the servers that they were backing up were, or if they were in fact being backed up. And then the second finding dealt more with there were folders that allowed some people to have access to them that in fact probably didn't need access. Now, we don't have any knowledge from the fact that anybody improperly accessed those, but when we audit, there is a a theory that certain people should be limited only to the minimum amount that they need to access, and we don't need other people to get in there if that's not part of their job duty. So there was a concern that there could possibly be access or unauthorized access had we not made that comment. And my understanding is they're working towards getting that corrected as well.
You're always looking over local governments as well, doing regular and special examinations of those. What stands out as maybe a recurring issue that local governments or local officials
well,
have?
and we've talked about this before, kind of a recurring, and a lot of times it's overlooked, but a lack of segregation of duties. And what I mean by that is you've got one person doing everything, taking cash in, making deposits, and there's no one looking over their shoulders. And generally, if you've got somebody that you can trust, that doesn't blossom into something more. But we had a situation, and they just recently pled guilty. We did an audit of Jackson County, and the former treasurer there, we found that she had written herself about $124,000 more in checks than what she was supposed to have, about half that from federal, half of that from just the general fund. And so we referred that to the FBI, and they have since found more. I think they ended up finding a total of like 162. Well, she has since pled guilty to that. So that's something like lack of segregation of duties. We always want to make sure that people take that seriously.
If people see things going on or things that appear to be wasted tax dollars to them, what action can they take to get your attention?
Well, and that's the great thing as citizens. You have the opportunity to let us know. We have a website, auditor.ky.gov. There's called Safe House. They can click on that, or they can call 1-800-KY-ALERT and provide those tips. And if we're actually auditing, say, like a county, we can refer those tips to either our auditor, or if there's a CPA auditing in that county, and then so they can take a look at that and see if they can expand their testing. If it's something other than the county, then we can take a look and see if it's something we need to approach.
Are you busy right now, heading into the spring?
We are very busy. I mean, we're doing a little bit of everything. Of course, we do about 600 audits per year, and we're always looking, at new special exams. Of course, we have a lot of stuff that we just do statutorily, but we are very busy.
It's an election year. You're up for re-election.
It is an election year.
Does that make? I mean, this is a kind of office that I would think that's somewhat difficult in that. It's partisan, and people question, why is it partisan to be the auditor? You're a Republican. Do you pick on the Democrat counties and so forth? Is that something that is difficult as a person who holds that office?
You have to walk a fine line. When I first came in, I told all our auditors, I don't want to hear that you've targeted anybody. I don't want to hear that you've given anybody a pass. I just want you all to follow the data. And I have jokingly said that I am elected as a partisan, but when I come into that office, I take that partisan hat off, put on my independent, nonpartisan auditor hat, and we just go to work.
Auditor Mike Harmon, thanks for coming. Appreciate it very much.
Appreciate it. Thank you.
Keep it here with us on Mid-Morning and WKYT's Kentucky Newsmakers. Fayette County Health Commissioner Dr. Kraig Humbaugh will talk about some precautions maybe we should all be taking. It's ahead. Welcome back to Kentucky Newsmakers on WKYT. We've been seeing some trends in the news lately that caused us to want to talk with our next guest. UK Healthcare is restricting hospital visits after a spike in flu cases, part of some widespread activity in Kentucky. Pertussis or whooping cough cases have now been reported in several Lexington schools. There was a lot of attention recently to the restaurant inspections in Fayette County when some well-known eateries were called out for problems that could make customers sick. Dr. Kraig Humbaugh is Fayette County's Health Commissioner, and he's joining us today. We've let some issues pile up since you were here last.
Thank you, Bill.
We appreciate you coming in. So here we are. Let's talk about being in the middle of winter and things are going around out there. The flu season proving to be tough this year, although not as deadly as some years that we've had.
Yeah, it's making an appearance again here in Kentucky, as it usually does in the winter. Flu is considered to be widespread. Activity is prevalent around the state, and Lexington is no exception. That's not unusual in January and February, and that has caused some restrictions at certain hospitals and nursing homes. Again, we've talked about this before, but the best thing to prevent the flu is get the flu vaccination. Wash your hands frequently. If you cough or sneeze, do that into your elbow or your sleeve, and then if you're sick, stay at home.
On and on we hear people who do not get the flu shot say, well, they have qualms about it.
Right. Well, the flu shot is not 100% effective, and on the average season, it's usually about 50% effective. But what I always tell people is, if you get the flu shot, then you're 50% less likely to get the flu than the next guy who didn't.
Is it potentially likely to lessen the severity of the case?
It can do that as well.
When we see places like UK Healthcare putting in visitor restrictions and others, as you said, what should that tell us about the activity out there? That they're having a problem at their facility?
Well, I think what it tells them is if they're being proactive and they're taking steps because they don't want to see flu spreading at their facility into their patients or to their staff, and so they're being proactive into trying to prevent the spread of flu in those facilities. And they have some of the most vulnerable people in hospitals and nursing homes, and they want to protect those folks.
Do those precautions usually have good outcomes?
They often do, because again, they're stepping up, wearing masks, telling people stay home if you have the flu, and also using more hand sanitizer if you're not at a hand washing station.
We all may have thought that pertussis or whooping cough was largely a thing of the past, and now suddenly several cases around Lexington in schools. What are your concerns about that?
Well, there has been a cluster here in January and February of pertussis or whooping cough cases. Whooping cough is caused by a bacteria, and it actually circulates in Kentucky year-round throughout the year. It's often carried in the adult population, and adults don't tend to get as sick with whooping cough. They do tend to get the bacteria, though, the illness, because often they're quite a ways away from their initial childhood vaccinations and they're losing immunity. But most healthy adults have relatively mild cases. Our concern is that when the adult population spreads the whooping cough bacteria to very young children, like infants less than 12 years of age or other vulnerable populations. So infants less than 12 months of age, who get whooping cough, about half of those have to be hospitalized, and 1 in 100 infants die who get pertussis.
So can you have the specter of an adult who generally just thinks they have a sort of a nagging cold,
but
then they're passing on whooping cough to kids?
Exactly. And one study showed that a full 20% of adults who had a persistent new cough for over 3 months had whooping cough and didn't realize it.
Parents may have thought, that they had their kids vaccinated, that they shouldn't get whooping cough, that nobody should get it for lifetime as a result of getting that shot. Do they need a booster or what?
They do need a booster at 11 to 12 years of age. So that's really important. And those of us who are adults also should get that booster if we have it. Now, right now, the booster is called Tdap, and it's combined with tetanus and diphtheria. So when you go in for, let's say, your tetanus booster, you can get that combined shot that also has protection against pertussis.
I'm sure you're watching another trend in several other states. I think about 10 states have cases of the measles. Fortunately, in Kentucky, at this point, we have not had that.
We have not had any here in Fayette County, and we'll continue to surveil for that, to watch. But we haven't had any reports of measles here, which is knock on wood.
Exactly.
Yeah.
Well, the most recent restaurant inspections were attention-getting. A series of stories by Janet Patton of the Lexington Herald-Leader were eye-opening. What causes so many restaurants, including upscale establishments, to fall short of public health standards?
Well, it's a great question. So first of all, what we do in terms of environmental health inspectors inspecting restaurants is probably one of the most visible ways that people realize that we help Lexington be well at the health department. And what we're doing is enforcing federal and state food codes. And when we go in to inspect, and that's often unannounced, that's a snapshot of what's happening at that particular restaurant on that given day. And sometimes the performance is good, and sometimes the performance is not as good as what we would like. And so restaurants who are consistently underperforming, we place them on what we call a probationary list, and they get special special attention or special help and more frequent inspections to help aid them to come up to where we feel they should be in terms of their restaurant scores.
What kind of training is required of food handlers, and is it adequate?
Yes. Well, we provide food handler training and it's required for all food handlers.
Yeah.
And it can be, we have both on-site classes at the health department, but more and more of our food handlers also take online classes. And food managers are also required to take classes as well, a different type of training for higher level employees. But a lot about it is about keeping hot foods hot, cold foods cold, and not cross-contaminating, and of course cleanliness of the facilities.
Obviously, you're being very transparent when you release all of the details about those inspections. Do restaurant owners sometimes push back at some of those details getting out there?
Well, we're actually lucky in that most cases we have a really good relationship with the restaurant owners and the managers at the restaurant. And if they do perform poorly on an inspection, then we try to work with them to help them to be able to fix those problems that they're having. And often we'll have a conference with them. And even if we have to close them, often within a few days, they're able to solve or resolve those issues and get back open.
I know you're a man of specificity, but should generally people feel comfortable eating out, do you think?
I think so, but I always tell consumers or patrons, as you said, we try to be very transparent about the scores. So when you're trying to decide, look at the placard and the restaurant where you're going to. It should have the score and what the basics of the inspection. Or, go to our website and peruse the scores on our website at lexingtonhealthdepartment.org.
Are the hepatitis A concerns lessening?
Well, unfortunately, we're still seeing at least a case a day has been being reported here in Lexington, and we're now up to over 160 cases associated with this particular outbreak here in Lexington alone. And when you contrast that with the fact that we normally have about a case of hepatitis A a year, a case a day is so much more. And although we did have a peak number of cases in November, we still continue in January and December to see quite a few cases, and we have not yet by any means declared victory on this, and unfortunately we need to get more and more people. We're glad for the people who've been vaccinated, but the best way to stop this is going to get more and more of the community vaccinated against hepatitis A.
Fayette County Health Commissioner Dr. Kraig Humbaugh is our guest. We have some more questions for him before we go on Kentucky Newsmakers. Hope you'll stay with us. Welcome back. It's Kentucky Newsmakers on WKYT. We're visiting with Dr. Kraig Humbaugh. He is Fayette County's health commissioner and learning about lots of topics. The opioid crisis has not let up, Dr. Humbaugh. We're still losing young people in large numbers to overdoses. Any light at the end of the tunnel that you can see?
Well, it has been very challenging for all of us. We still are seeing significant numbers of people who are dying from opioid overdose deaths here in Fayette County. That number seems to be leveling off, but certainly not decreasing at all in the county. And one of the things we try to do at the health department is to offer naloxone, which is an antidote to opioid overdoses and gives people a second chance if they are overdosing to recover and then hopefully get into treatment and recovery. Yeah.
IV drug use has caused all sorts of issues. There's a move in the state legislature which approved these needle exchanges a couple of years ago to now require those exchanges to be one for one. That is, you do not get any more needles back than you brought in.
Right.
Do you take a position on that?
Yeah, we do. We think we have a really good track record at the Lexington-Fayette County Health Department. We've been operating our needle exchange for about 3 years now. We've seen actually over 21,000 visits and almost distributed over 750,000 needles just in Lexington alone. But we find that our mature clients do return their needles, and we're at a rate of about every needle that goes out, about 0.83 0.83 to 0.89, somewhere like that, come back to us. And so we would say the literature really does not support a strict one-to-one exchange as a viable method of reducing the spread of bloodborne diseases like HIV and hepatitis C. And that's really the design of the program. The program's designed to do that. And so a strict one-to-one would, I think, would be detrimental in terms of our clients and what we're trying to accomplish in terms of the spread of the disease.
How often are you able to get people into treatment because of the contact you have in that program?
Well, we're fortunate there in that we have a lot of partners in the city and around the city who come in to provide counseling services to our clients. And so during the hours that we're open for a needle exchange, which is on Wednesdays from 3 to 6 and Fridays from 11 to 4 at our 650 Newtown Pike location, we have counselors that are available. And if that's the day that our clients say, hey, I want to get into treatment, they're available to talk with the counselors then.
Less than a minute. I want to try to get this in. Vaping or juuling, becoming rampant among teenagers right now.
Yeah.
How concerned are you?
We are concerned about that. It can be, many of these products contain nicotine. The juuling and vaping products, they can be an entryway for young people into smoking, traditional smoking. They're also very easy to conceal. Sometimes they're just like little thumb drives, and so the parents may not know that they're vaping, and so yes, it is a concern for us.
Commissioner Humbaugh, thanks for coming. Appreciate it very much.
Thank you.
Thank you for joining us for this edition of Kentucky Newsmakers. We'll see you bright and early this week on WKYT This Morning, on mid-morning at 10, and WKYT News at noon. Make it a good week ahead.